Hello and Namaste viewers. Today we will be talking about heart health and its correlation to yoga. It is widely believed that medical interventions and surgical procedures are the only answers if you are suffering from a cardiac condition. But is that fully true? That is the answer that we are trying to find. It is a proven fact that yoga can help you prevent, slow, stop, and even reverse the impact of these heart conditions on your body. We will be talking about just that in today's video. How do these practices work? What should you do to make your heart function better? This video will be in two segments. The first segment is going to be about the people who have never worked out in their life. The second set of exercises are for people who already follow an active lifestyle, who have done some bit of workout or some form of exercise otherwise as well. Yoga truly fits all, whether you are just a beginner or an intermediate level practitioner or an advanced practitioner. It has solutions for all your problems. I would like to tell you a couple of prerequisites that you need to keep in mind. Please keep a gap of about 2 to 3 hours between your yoga posture or any other exercise practices and your meal times. Number 2 is to not push yourself beyond your body limits, beyond your comfort zone. Don't try to overachieve something. There is nothing to prove here. You just go at your pace. Number 3 is that if you feel any pain or discomfort while doing these practices or even after, please consult your cardiologist for the medical intervention. Now let's get started with the first segment. The first segment is for beginners, the people who have never worked out before. This is a set of simple asanas and breathing practices. Those will help you improve your heart health. Let's start with the first posture or asana. It's called Parvatasana or mountain pose. Now to do the mountain pose, please sit in a cross-legged posture. You can sit like so. This is called Sukhasana or the normal cross-legged posture. You can also sit in Ardha Padmasana or half lotus by keeping your foot above your thigh. And if it's comfortable and if you're flexible, you can keep the other foot also over your other thigh to make your Padmasana nice and strong. Make sure that you're sitting on your sit bones, your spine is absolutely erect, your heart is open, your lungs are open, and you're able to breathe in and out nicely and effectively. Take your arms on the side, inhale and take your arms up over your head. Join them in a namaste. Breathe in and breathe out. You can choose to open your eyes or you can also keep them closed. As per your comfort, the idea is to just breathe in and breathe deeply. And slowly breathe out. You can stay in this posture for 5 counts, 10, 20 or even 30. Start slow and build your stamina upward. Now to add a little twist to this asana, you can also include a side bend. So as you exhale, go on the left and just be here. Again, you can choose to stay here for as long as you're comfortable for. Inhale, come back to the center and exhale, let's go to the other side. Keep your heart open, hands nice and long and exhale, come to the center, bring your arms down. This asana is very good for your heart health because your chest is open, you're breathing in the air and a full supply of oxygen is reaching your heart in your deep breaths. The fully oxygenated blood is reaching all parts of your body thereafter. Let's move on to the next asana. The next asana is also a sitting asana. Come in Vajrasana. Join your knees in the front and join your toes at the back. Now to do this asana, we will be taking our arms back. Just take your hands slightly back behind your feet and just slowly extend your heart up. Look up and deeply inhale and exhale. You can choose to be in this asana for, again, 5 counts, 10, 20 or 30, wherever you are convenient. You can slowly build it up as you go along the way. There's no competition, there's no need to rush in, just do as much as you're comfortable with. Breathe in and breathe out. Again, your heart is open, your heart is receiving full supply of oxygen in this asana. The next asana that we are going to do now is called Paschimottanasana, or seated forward bend. Now to do the Paschimottanasana, we will just slide our legs forward. It's called Dandasana. Make sure that your spine is erect. You are sitting upright. You are not slouching back or forward. If you are, then slowly try to open up your chest and sit straight. Just sit straight and be here. Inhale, take your arms over your head, and exhale, bend forward. As you bend forward, remember that you are hinging from your lower back. You are not collapsing your chest in between. So don't do this. Don't collapse. The idea is to open this area so that a nice supply of air can reach your lungs and your heart. Come forward. Once you're here in the forward bend, then if you're comfortable, slowly bend forward and try to take your head to your knees. Stay in the position for a few seconds. You can stay here for 5 seconds, 10, 15, 20, or even 30, as much as you're comfortable with, and then with an inhalation, come up. Now, if you're somebody who is not very flexible, if you are not able to reach all the way up to your toes, then reach wherever you can. If you're here at your shins, be here. If you're uncomfortable even there, if you can reach just your knees, let's say, or just a little bit under your knees, it's absolutely okay. The idea is to keep the back straight and keep the chest open. Breathe in and breathe out. Keep your hands here and slowly try to bring your chest forward. That's it. Just stay here. If you're not able to reach in the final posture, it's absolutely no problem. Take your time and slowly build your flexibility and stamina to reach up to the full posture. Inhale, come up and hands down. Let's move on to the next posture. Next asana is called Gomukhasana, or cow face pose. For that, we will just bend our legs from here in this position. Knee is tapped over the other knee. Both my heels are outside. I'm not sitting on any of my heels. My legs are in this position. Right leg is over, left leg is under. Take your right arm up. Inhale, bend your arm. Take the left arm. You can support your right arm and try to lift the elbow up, pointing to the sky. Take the left arm from under and try to clasp your hands together. Now, if you're somebody who's not flexible enough, you're not able to clasp your hands together like I am doing, then it's absolutely okay. You can keep your hand down. You can also take the help of a dupatta or a yoga belt and try to hold it in between. Slowly try to reduce the gap and eventually come to clasping your hands together. Just stay here in the posture. Breathe in and breathe out. To come out of the posture, release your hold. Take your arm up and down. Bring your arm forward and sit like so. You can stay in this posture for 5, 10, 15, 20, or even 30 seconds, wherever your comfort lies. Slowly build up your stamina and go up to increasing your timing in the posture. This asana is very good for your heart because again, you're stretching your heart out, you're stretching your lungs. There's a full supply of oxygenated blood to the heart, again helping it to function better and helping it heal better. Let's move on to the fifth and the last asana for the beginners. For that, let's stand on our mats. Stand comfortably, trying to keep our legs together. If joining your feet together and standing is a little bit of a problem for you, you can create a comfortable gap and stand like such. Inhale, take your arms over your head and breathe in. Breathe out. Take another inhalation and trying to lift the chest towards the ceiling. Just breathe in and breathe out. You can also choose to close your eyes or keep them open. Keep a gentle smile on your face. To come out of the posture, exhale and turn your arms down with a backward rotation of your shoulder. So this is a very good posture for beginners to open their heart further and bring all the beautiful oxygenated blood to your heart, making it function better. Now we will be talking about the second segment of practitioners, people who already follow some sort of exercises or workout regime, who are active in their lifestyle. What can they do? But beginners, you must also stay tuned to this video, because at the end of this video, I'm going to be talking about pranayam and breathing practices. Those are equally effective for all. Whether you are a beginner or a medium level practitioner or an advanced one, these exercises are going to work for all of you. The first asana that we are going to do is called Warrior One pose or Veerbhadra Asana 8. For that we have to create a gap between our legs. Spread your legs around. Point your left leg at 90 degrees and keep your right slightly in at 45 degrees. Now, twist your body, lunge from the left leg and inhale, take your arms up over your head. Just stay here, deeply breathe in and breathe out. Breathe in and breathe out, keep the back leg straight and just be here. You can choose to be here for 10 seconds, 15, 20 or even 30. The next posture we are going to do is Anjaneyasana. We are going to go directly in that posture from here. For that you have to add just a small back bend to the warrior pose. So inhale. And exhale. You can stay in the posture but keep breathing in and out throughout the posture. Do not hold your breath. In back bends, people usually have a tendency that they forget to breathe in and breathe out. Please don't do that. Please keep breathing in and out. Just exhale and come out. These asanas are again very good for your heart health, because your heart is open, lungs are open, a full supply of air is reaching to your heart and your lungs, and hence the blood is enriched with oxygen, improving the functionality of your overall body. The next posture is Warrior 2. For that, we are going to just open our arms in a T position, open our body on the side. So from here, my body is now going on the side, arms are open in a T position, look forward, gaze at the thumb of your left arm and just be here. Breathe in and breathe out, open your chest area nicely and breathe in and breathe out. You can choose to stay here in this posture for as long as you want. Now, next posture, inhale and let's go in reverse warrior or Viparit Veerbhadra Asana. Just stay here. Again, do not hunch forward. Just try to open your chest, keep it to the ceiling and keep breathing in and out. Keep your arms nice and straight and just be here. Breathe in and breathe out. To come out, exhale and be here. You can add another asana to this sequence. Just on your lunge leg, keep the left arm and take the right arm over your head and extend. Do not collapse your chest in. Expand your chest and lift it to the ceiling and keep breathing in and out. In and out, and choose to stay for as long as you can. For the next posture, bring your arms down on the floor. You can also keep your knee down. Inhale and be here. This is a variation of Anjaneyasana. Breathe in and breathe out. Push your hips slightly forward so that a nice stretch comes to your quadriceps as well. Inhale and exhale. Stay here for as long as you can. And once you're done, bring your palms down. Lift your leg up. Take your leg back and come into downward dog position or Adho Mukha Svanasana. For this, just lift your hips up, point them to the ceiling, draw your navel in and press your palms on the floor, trying to send the floor away, pressing the chest towards my knees and gazing at my knees or thighs or at the belly. Keeping the chest in action, in activation, legs are active, nice and strong, and chest is pressed back. Inhale and exhale. To come out of the posture and relax here. The asanas and the sequence that we have done today is very good for improving your heart health, because a lot of these problems occur out of our wrong posture because of our desk jobs or we are driving. So our position is constantly like this for long hours. So once you do these postures, you're opening your lung area, you're opening your heart, allowing a good supply of oxygen there, and also correcting your deformities in the spine, and also correcting the posture, relieving you of all the other back related issues as well. Now, after this, we will be going into pranayama practices. Let's learn a couple of breathing patterns. Those will really help your heart feel better. So, for that, let's sit in a comfortable cross-legged position. Let's sit like so. The first pranayam that we are going to do is a very simple pranayam practice. It's called equal breathing, or it's called yogic shwas. Please sit in a comfortable cross-legged position. If you're comfortable in Sukhasana, stay here. If you're not, you can also sort of keep your legs in a relaxed position, or if you're flexible, you can also take Ardha Padmasan or full Padmasan, wherever you are comfortable. Padmasan is a really intense posture, so only do it if you are really flexible. Keep your spine upright and erect, keep your chest open and sit like so. For the yogic shwas, we are going to be breathing in and breathing out for the similar duration of time. So if you're breathing in, do a mental count in your head. If you're breathing in for 3 counts, then breathe out also for 3 counts. So let's start. Keep your hands in Gyan Mudra. Just keep your index finger and your thumb together. Keep them over your hand, or you can also keep them open like so. Inhale and exhale. Now observe again. I'll be inhaling for 3 counts and exhaling for 3 counts. So you inhale and exhale for equal amount of time. That's all. So you have to do 10 to 15 repetitions of this if you are a beginner. If you are slightly forward ahead in your practice, you can do about 20 to 30 rounds of this. You can slowly build it up, time-based as well. You can do this for about 5 minutes, then slowly build it up to 10 minutes. It's a very, very effective pranayama practice that's going to really help your lungs and your heart feel better and eventually function better. The next pranayama practice that I have for you is called Anulom Viloma Pranayama. We'll be taking our hands in Vishnu Mudra. So take your first 2 fingers, index and middle finger, and keep them at the bottom of your thumb here. Keep your ring finger and little finger here, and your thumb is going to be like so. We are trying to create a little gap between this because we are going to hold our nose with our thumb and our ring finger. Anulom Viloma Pranayama is also called Nadi Shodhan Pranayama. It is a purification pranayama which works on purifying your Ida and Pingala Nadi, hence helping your body and your mind to attain a better state of balance. It is believed that a lot of health conditions happen in your body when your Ida and Pingala are not in balance. So this is a very good pranayama which is very effective in balancing those 2 nadis. And also, if this is practiced regularly for about 15 minutes a day, of course, 15 minutes a day is a very long time if you're just a beginner, but you can slowly build up to that. It is a proven fact that if you do it for 15 minutes a day, it helps bring out and bring down your heart blockages and improve the functionality of your heart. So start with your Anulom Vilom Pranayama with, let's say, 2 to 3 minutes a day, and slowly take it up to 5 minutes, then 7, 10, and build it up to 15 to 20 minutes a day. It is going to be really, really, really effective in improving your heart health. Before we close this session, I would like to mention 3 key points here that you must take into account before doing these practices. 1. There should be about a 2 to 3 hour gap between your meal time and your practice time so that you can practice with ease and your food is settled in your stomach. Second is to always check your comfort in a posture. If you're not comfortable, if you're having any pain, please stop it right there and then and consult your doctor before practicing these again. The third point is to take care of your knees in particular. If you have any kind of knee injury or knee surgery, or even the stomach surgeries, ulcers, or any kind of hernia, please check with your doctor before doing these asanas. That was it from my side. Thank you for watching. Please take care of your heart. Stay healthy, stay active,